In the world of cardiothoracic surgery, the stakes are often life or death. But for Dr. Jonathan Cunha, chair of cardiothoracic surgery at Mayo Clinic Arizona, the most important element in those moments isn't the scalpel, it's trust. Dr. Cunha's career spans institutions, disciplines, and continents of innovation. From a PhD in microbiology and immunology to pioneering advances in lung transplantation, his impact in medicine is both technical and deeply human. But ask him what defines success in a surgical department, and his answer doesn't start with data. It starts with people. Trust gets built every day, he says. Predictability, accountability, and transparency, those are the foundations. And it starts in our business with excellence in the operating room. From there, trust grows. The making of a surgeon-scientist before becoming one of the leading voices in cardiothoracic surgery, Dr. Jonathan Cunha began his journey in the lab. At the Medical College of Wisconsin, he completed both his MD and PhD, the latter focusing on the discovery of a novel interferon-induced immunomodulatory cytokine, ISG-15. His research shaped early understanding of how the innate immune system can be harnessed to fight viral infections and cancer, laying a foundation for later work in immunotherapy. After postdoctoral training at the NIH and surgical training at the University of Minnesota, Dr. Cunha entered clinical practice with a dual mission: to push the boundaries of complex thoracic care and to elevate the educational standards in surgery. He quickly became a nationally recognized educator, designing novel curricula and earning accolades such as the Association for Surgical Education's Educator of the Year. Yet it wasn't until he reached Mayo Clinic Arizona that his multidisciplinary vision would truly come to life. There, as chair of cardiothoracic surgery and surgical director for both ECMO and lung transplantation, Dr. Cunha oversees some of the most critical and collaborative work in modern medicine. Communication at the speed of urgency. In his role, communication isn't just a skill, it's a survival tool. Whether coordinating between oncology and transplant teams or navigating a middle-of-the-night emergency, clarity is essential. Be clear, be direct, explain why, Dr. Cunha advises. Say the same thing to each team, even if there's conflict. Communicate often and regularly. His emphasis on explanation and rationale builds not just understanding, but trust. Every time you do this, you build on that trust. And trust is key, but as any medical leader knows, miscommunication is inevitable. Dr. Cunha's approach? Pause. Reflect. Assume positive intent. I've learned that coming from a place of curiosity, not accusation, is essential, he says. Don't let issues fester. Resolve them head on. Collaboration is standard of care. Ask Dr. Cunha what sets Mayo Clinic apart, and his eyes light up. The multidisciplinary collaboration here blew me away, he says. We deal with complex patients every day, and it's far more effective when you have the support of diverse expertise across 3 Mayo sites. You can't believe it until you see it. This isn't just philosophy, it's operational. Oncology tumor boards, transplant selection committees, and quality improvement sessions provide structured opportunities for cross-disciplinary input. It's a model that Dr. Cunha believes should be the norm in modern medicine. Putting the patient at the center means no specialty works in a silo, he says. When you work like that every day, breakthroughs happen. Speaking different languages in the same room. Of course, collaboration requires adaptation. One of Dr. Cunha's strengths is tailoring communication to his audience. A conversation with a surgical colleague about operative strategy is nothing like a conversation with a patient's family. Patients need the big picture. You have to be sensitive to their background and health literacy, he explains. Trainees need expectations and rationale. Peers need context and specialty relevance. You meet people where they are. Even in a world of emails and EMRs, Dr. Cunha still values old-school communication tools. Believe it or not, we still use pagers, he laughs. And when all else fails, call. Or better yet, talk face-to-face. Remote doesn't mean disconnected. One of the modern challenges facing medical teams is the integration of remote staff and satellite facilities. Dr. Cunha is candid about the difficulty. I'm not sure anyone has the perfect solution. But he's committed to making the effort. From regular check-ins to creative gestures, like ordering matching snacks for remote team members during in-person events, he's constantly looking for ways to build connection. These are small things, he says, but they matter. They show people they're part of the same team. Feedback as a tool, not a weapon in high-performing teams. Feedback can be a delicate dance. Dr. Cunha sees it as essential, but nuanced. Feedback given in real time is always best, he says. But it has to be tailored. Some people take things personally, and a single comment can derail their performance. Others need directness to grow. You have to know your team. He likens the process to coaching. You don't coach a rookie the same way you coach a superstar. You need to understand what works for each person. Leadership modeled after the Navy SEALs. One of Dr. Cunha's favorite examples of elite teamwork comes from outside the hospital. I've been fascinated by teams like the Navy SEALs for years, he says. What if we could get to a state where everyone was willing to sacrifice for each other, for the mission, every day? That's the team I want to build. He quotes Phil Jackson. Good teams become great ones when the members trust each other enough to surrender the me for the we. For Dr. Cunha, that's not a slogan, it's a goal. And it's not lost on him that medicine, like military operations, can be a life or death endeavor. The OR is where it starts, he says. Get that right, and trust spreads. A career still in motion. Dr. Jonathan Cunha isn't slowing down. With active leadership in lung transplant innovation, ongoing research in thoracic oncology, and an ever-growing list of mentees, his influence in the field is only expanding. And at the heart of it all? Relationships. We work in a high-stakes, high-stress world, he says. But if you invest in people, really invest, the results take care of themselves. It's that combination of technical excellence, human empathy, and visionary leadership that sets Dr. Cunha apart. As a surgeon, educator, and leader, his greatest asset may not be what he knows, but how he listens. And in a world of constant noise, that might just be the most powerful skill of all.